Mantle cell lymphoma is a rare and fast-growing cancer that is different from other lymphomas in a few ways. It starts in the lymphocytes, which are infection-fighting white blood cells that are part of the immune system. Some key differences include where it starts, what causes it, how it grows, who is at risk, and what happens after treatment. Understanding these unique features is important for getting the best treatment. Lymphomas are divided into two groups, Hodgkin's and non-Hodgkin's. Mantle cell lymphoma is a type of non-Hodgkin's lymphoma that grows in B cells, which help the body fight germs. It makes up about 5% of all lymphomas and 2% to 7% of all non-Hodgkin's lymphomas. This cancer gets its name from the mantle zone, in lymph nodes, where the abnormal B cells come from. Lymph nodes are small glands located in various parts of the body, such as the neck, groin, and armpits, and they contain lymphocytes. The cancerous B cells can spread to other parts of the body, such as the liver, stomach, intestines, or bone marrow, through a system of channels that connect the lymph nodes. The exact cause of mantle cell lymphoma is still unknown to doctors. Over 90% of individuals diagnosed with this type of cancer have a genetic mutation that causes an overproduction of a protein called cyclin D1. This protein is responsible for enabling abnormal B cells to multiply uncontrollably. In order to diagnose mantle cell lymphoma, doctors often test for the presence of cyclin D1. Lymphomas are categorized by doctors based on their growth rate and the appearance of the cells under a microscope. Fast-growing lymphomas are called high-grade, while slow-growing ones are called low-grade or indolent. Mantle cell lymphoma is unique because it can exhibit characteristics of both high-grade and low-grade lymphomas. The cells of mantle cell lymphoma are small and resemble those of low-grade lymphomas when viewed under a microscope. However, they can spread rapidly like a high-grade cancer. It's important to note that a small number of people with mantle cell lymphoma have a slower growing form. Mantle cell lymphoma is more commonly found in men than in women and usually occurs later in life, with most people being diagnosed in their late 50s to mid-60s. It is rare for young people to be affected by this type of cancer. Due to its rapid growth, mantle cell lymphoma is often diagnosed at a later stage when it has already spread. Treatment for mantle cell lymphoma is similar to that of other non-Hodgkin's lymphomas, involving chemotherapy and other drugs. Many treatments include a combination of the monoclonal antibody rituximab, Rituxan, with various chemotherapy drugs. Mantle cell lymphoma can be put into remission with treatment, meaning that there are no longer any signs of cancer. However, it is possible for the disease to come back. Your doctor can discuss FDA-approved drugs for treating recurrent mantle cell lymphoma. Additionally, researchers are currently testing new medications and drug combinations that may also be effective in treating this type of lymphoma.